Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we discuss problems in the healthcare system and take actions to try to make the system better for all of us. Let's talk about reproductive rights first. We have some news from Kansas. A judge in Kansas put a new state law on medication abortions on hold and blocked older restrictions that for years have spelled out what providers must tell patients and forced patients to wait 24 hours to end their pregnancies. These were scare tactics, of course. The ruling was another big victory for abortion rights activists in Kansas, where a statewide vote in August of 2022 decisively confirmed protections for abortion access under the state's constitution. District Judge K. Christopher Jairam's order suspended some restrictions that have been in effect for years. The waiting period had been in place since 1997. The judge's orders will remain in effect through the trial, and it is expected in June of 2024. So Kansas is okay, at least for the next 3/4 of a year. The suit was brought, of course, by abortion providers to make sure that the rules were clear. There is a link, of course, in the description box below to the Healthcare Advocacy Newsletter, which is the text of this video, and in there is the full Associated Press report on that. You know, as long as we're talking about reproductive rights, let's take an action, because we have a problem that almost half of the country treats women as second-class citizens. Let's stop it. Let's remind our representatives in Washington, member of Congress, and senators that women are to be treated as first-class citizens, not second-class citizens. They need to pass the Women's Health Protection Act to restore the right to an abortion nationwide. When things fall to states' rights, you know what? We become a nation that becomes widely disparate. You can have a right in one state and not in another. Okay, let's make it, we all have the same rights across the whole country. So you can call or email your congressperson and your senators. If you go to the resources section in the Healthcare Advocacy Newsletter, you can get contact information for them, and just tell them, pass the Women's Health Protection Act. Real simple. Or you can use ResistBot, my favorite, to send an email to them. All you have to do is send a text to 50409, and here's the text: sign, SIGN, PYIIVR, and here's the email you'll send. I'm your constituent, and I want you to know that it's very important to me that you co-sponsor and actively support the Women's Health Protection Act that will restore the right to an abortion nationwide. Almost half the country treats women as second-class citizens. Are you okay with that? I promise you, I will remember your stand on the issue. Okay, take the action, that's it. I don't know if you've heard this one about pharmacists being fed up. Pharmacists are protesting deteriorating working conditions inside the nation's largest retail chains, and they launched their third and largest walkout of the season this past Monday with a 3-day movement they've dubbed Pharmageddon. Part of the problem is that pharmacists are not unionized. So there are organizers to this, but they do not have a union with which to easily negotiate with their employers. Anyway, the organizers estimate that the effort has drawn in about 4,500 pharmacists and pharmacy technicians from multiple chains, including CVS, Rite Aid, Walgreens. It also drew support from the American Pharmacists Association, the industry's largest professional organization, which said in a statement that it stands with every participant in the movement. Okay, let's talk about the cost of medical procedures. What a doctor visit or a medical procedure costs varies dramatically by county in the United States. Now, Medicare sets payment rates administratively, but when private insurance is involved, what they do is they negotiate rates with providers or with provider networks, and those negotiated rates are what we're talking about. A recent report in the Journal of the American Medical Association, and there'll be a link to it in that newsletter, using Humana data, found generally higher rates for office visits and medical procedures in the upper Midwest, that's like Illinois and Wisconsin, and in the Southeast, and lower costs in the central U.S. and in Florida. More than half the U.S. population gets health insurance from private insurance plans, and such variation can have an effect on premium costs as well. The researchers looked at Humana's negotiated rates for 7 procedures. They included things like colonoscopies and patient office visits and high-severity emergency department visits as of October 22nd. The rate Humana paid to providers for office visits varied, are you ready? $69 to $114 across the country, according to the study. Higher-priced counties often were on the border with lower-priced counties, the researchers found. Overall, the prices commercial health insurers pay to hospitals and physicians have been rising quickly, according to a nonpartisan Congressional Budget Office report last year. This underlying cost growth has inflated consumers' health insurance costs. And of course, there'll be a link to the Congressional Budget Office report there. Here, I'm also going to include a graphic of the United States that shows the Humana data. It's interesting. You can sort of get a look at what your county looks like. I recommend you take a look at it. Okay, let's talk about the Affordable Care Act, because November 1st is this week, and that means if you get your health insurance from the Affordable Care Act, it is time to start shopping for plans. November 1st is the beginning of enrollment for those who purchased their plans on the Affordable Care Act marketplace. Last year, that was about 16.3 million of us. Millions who were disenrolled from Medicaid. Remember the Medicare unwinding when the COVID-19 pandemic ended, threw a lot of people who were on Medicaid off of Medicaid. So they have to start shopping for plans as well. Networks will be changing, so it's a good idea to log in early and find the plans that cover your providers and that have the coverage that you think you're going to need. Consumers this year are going to be asked to certify that they voluntarily agree to brokers' assistance and that their income and other information provided with brokers is accurate. Another good reason to not leave this for the last minute. I will point out that there are links to the government ACA marketplace and to a government website that has links to each of the 18 other states that do not use the government ACA marketplace, and that includes the District of Columbia, so 19 locations. Now, prices are changing. I've heard that some premiums may decline. However, most experts are anticipating 2 to 10% increases in premiums, of course. Experts say that that's another good reason to start early, and so look for those links to the federal site and to the site that has the 18 states links and the District of Columbia, because those locations have their own websites. Okay, now changing insurers might mean a lower premium. There are also online calculators, and I include one from healthcare.gov where you can sort of estimate what you might have to pay. So if you're in this ballpark, try and keep your costs low and your coverage high. In addition to premium subsidies, most ACA enrollees could qualify for reduced deductibles and co-payments and other kinds of cost sharing if their income is no more than 2.5 times the federal poverty level. That's about $75,000 for a family of 4, or $36,450 for a single-person household. Cost sharing reductions are available only in the silver level mid-range plans and are more generous for those on the lower end of the income scale. New this year, to help more people qualify, the federal marketplace will automatically switch eligible people to a silver plan for next year if they're currently enrolled in a bronze low-level plan, as long as the enrollee has not made an adjustment in coverage themselves. Well, good to check out to see what you really want. Anyway, also new is that you can stay on your parents' plan for the whole year that you turn 26 until, which is different than it used to be. It used to be that by your 26th birthday you had to pick up new insurance. So that's nice. Okay, this entire report was published by NPR, and of course there'll be a link to it in the newsletter. Okay, like this, share this, subscribe to this, subscribe to the Healthcare Newsletter. That's what we have for you today. Have a good day.